Hello, everyone. Thanks so much for joining us for this webinar about primary or premature ovarian insufficiency, which is a very much neglected topic and one that a lot of people don't know much about. But if you've chosen to watch it, maybe you have some personal insight and are looking for more information and support. So that's what we're here for today, to help you out. We've got a lot of amazing guests here to share their personal experiences, their research, and their stories of not being able to get support as well. So hopefully this will be enlightening and informative, and you'll know at the end of it a little bit more about where you can go to get some additional support. My name's Dr Kelly Teagle. I am the founder and principal clinician at the WellFemme Telehealth Menopause Clinic, and we have very recently realised just how underserved this community is in terms of being able to get the information and support they need. And there can be really devastating consequences to people's health and fertility, which is why this is such an important topic. Before we get started, though, I'd like to mention a couple of things. Firstly, a big welcome to country. So I'd like to acknowledge all of our Aboriginal and Torres Strait Islander viewers, and acknowledge and pay respects to elders past, present and emerging. I am currently broadcasting from Yuin country on the coast of southern New South Wales. And I'd like to also mention that when we talk about women's health, we do acknowledge that not everyone born with ovaries identifies as being a woman or being female. So I'd like to include everybody who was born with ovaries in this discussion. Okay, it's my role today to talk to you about what primary ovarian insufficiency is and tell you a little bit of the medical information before launching into talking to our special guests. What exactly is primary ovarian insufficiency? So what we're talking about here is the failure of the ovaries to produce eggs beyond the age of 40. And it can actually happen much younger than that for a lot of people. If your ovaries stop producing eggs regularly, which is what happens when we ovulate and have a menstrual cycle, if that stops after the age of 40, but under the age of 45, that's called early menopause, but before the age of 40, it's called premature ovarian insufficiency. Used to be referred to as primary ovarian insufficiency, but in talking about the way that it happens, the way that it occurs, sometimes that's inaccurate. So basically what it means is the ovaries have stopped producing eggs regularly, your estrogen levels fall, and this leads to symptoms similar to menopause, but occurring much, much earlier in life. And that has significant health consequences, such as infertility and increased risk of bone loss and cardiovascular disease at an early age. The other thing about primary or premature ovarian insufficiency is that it can be unpredictable. So even though your ovaries might stop producing any eggs before the age of 40, some women do spontaneously ovulate after that, and sometimes even conceive spontaneously, even though that's quite rare. So there is this unpredictability about it. How common is POI? Well, the prevalence varies according to different sources, and I might get one of our guests, Belinda, to tell us a little bit more about what the research is telling us on that. But in Australia and globally, the rates of POI are quoted as being somewhere around 1 to 4% of women under the age of 40. So that means somewhere between 1 in 25 or 1 in 100 women will get premature ovarian failure or insufficiency before the age of 40. This risk actually increases with age. So it's around 1 in 1,000 under 20, and it's about 1 in 250 by the age of 35. And then by the age of 40, it's about 1 in 100 who've experienced that premature ovarian insufficiency. So this is we don't have a whole lot of Australian specific data. This is sort of data that's quoted in a global context, but we are using these data in Australian clinical guidelines at the moment. Now, what are the causes and what are the risk factors for premature ovarian insufficiency? Well, it can occur spontaneously, or it can be the result of medical treatments such as chemotherapies or surgeries. But in a large number of the cases, over 60%, the cause is actually unknown. And this is referred to as idiopathic POI. But risk factors can include things like genetic factors and family history. So, if there is genetic conditions in the family that are prone to leading to this condition, that we think that's a factor in about 10 to 15% of cases. Autoimmune diseases can be a factor in 10 to 20% of cases. Lifestyle factors also can increase your level of risk, such as smoking. Medical treatments are a big cause, like chemotherapy, which actually affects the ovaries and stops them from being able to produce any more eggs. Surgery is also a really common one, which could be that you've had your ovaries removed because of dreadful endometriosis, or because you've got a BRCA gene mutation and you're wanting to take preventive measures to stop yourself from getting ovarian cancer, or there could be other gynecological reasons why surgery was recommended and ovaries were removed. But as I said earlier, most of these cases are what we call idiopathic. That means that there's no clear cause identified in over 60% of the cases. So, on top of the devastation of having the diagnosis, there's this real uncertainty and confusion about why it happened for a lot of women as well. Now, let's talk about the health consequences of, premature ovarian insufficiency, which are many and can be absolutely devastating. So, it has quite significant impacts on both physical and psychological health for people. Firstly, the infertility. So, if you're particularly young, you may well have been planning to start a family and then have that taken away from you. And so, sometimes the very first diagnosis of POI is because women have been trying to fall pregnant and haven't been able to. And then they go and they see the doctor and have tests which reveal POI. Menopausal symptoms are a really big one. So I can tell you, as somebody who had a relatively early menopause, that the symptoms of menopause, like hot flushes, mental confusion, mood disorders, that can all be devastating enough. But when you're experiencing that at a particularly young age, it's very, very confronting. And if it's particularly early, it can be even more severe and longer lasting and harder to treat. There are also, as I said earlier, long-term health risks, particularly that risk of premature cardiovascular disease and osteoporosis, with devastating fractures for people at a relatively early age because of the low estrogen. Low estrogen is a risk factor for osteoporosis and heart disease, and that normally happens at around the normal age of menopause. Your risk starts to increase, but of course, for people with POI, it started happening much earlier. Then, of course, there's these impacts on their cognitive and mental health. So, people talk about brain fog, confusion, memory loss. You've got those cognitive difficulties on top of wrestling with the diagnosis and the mental health implications of that. People can get anxious or depressed, have sort of all manner of stress disorders, and it can really impact on sexual function, as it does for women at a normal aged menopause, where the low estrogen level really impacts your libido and your ability to become aroused, orgasm, and just have normal sexual function in general. So, how do we diagnose this? Well, it's usually based on the fact that you've got either loss of your periods or low number of periods. That can be really tricky if you've already been started on, say, the pill, and your body thinks it's having a regular cycle because you're using the pill. So it sometimes is only when women come off the pill to try and fall pregnant that they realize that they don't actually have a normal cycle at all. So menstrual irregularity or absence can be a really tricky one and not always that reliable. If it's suspected, the doctors will often do a series of blood tests to, first of all, check that you've got the low levels of the reproductive hormones that tell us you've got POI, and also to exclude other potential causes of your loss of periods. Now, when it comes to treatment, one of the really important things is that if you're experiencing very low estrogen at a particularly young age with those long-term health consequences I mentioned, you really, really need to be on hormonal treatment to replace that estrogen at a young age, and take it up until at least the normal menopausal age, which is around 50 to 51. Now, there may be instances where that's not possible. For example, maybe you were treated for an estrogen sensitive cancer, and that might be a player, and so they may not want you to be on hormonal treatment. But wherever possible, we do put women with POI, excuse me, on hormonal replacement treatment. Then perhaps you need fertility support. So if you are somebody who's been diagnosed with incipient or oncoming premature ovarian failure or insufficiency, they might want to treat you very early on, to try and get some eggs to be able to store, or store some embryos, and give you other options with regard to fertility. And we have some guests who can tell you a lot about that sort of stuff later on. Psychological support is super important, and this is where not only psychologists and health professionals who are aware of POI as an issue are really important to connect with, but also putting women with POI in touch with one another for that kind of support, hearing others' stories, getting that validation, finding out options, and sharing experiences. So the psychological aspects are really super important. And so, as we've said, there's a very wide-ranging issue with a lot of potentially devastating consequences. So, why is it so important to discuss? It's very under-recognised. The numbers are relatively low compared to other gynecological conditions that are more well recognised, and so we want to raise this awareness so that people will think of it as a possibility. That people, when they are experiencing reduced periods, less periods, early loss of periods, or that when doctors see these people, that they will think of it and go down that pathway of trying to diagnose early, because getting awareness going early and getting early intervention with treatments can make all the difference for the health and well-being of people suffering from POI going forward. So I think I will call it there myself. I think that's enough for me to go on with for the moment. And I'd like to then invite some of our guests to have a bit of a chat to you about their experiences. So firstly, I think I will call on Karima. So Karima, we're very lucky to have her all the way from the States. She was diagnosed with POI herself in 2007, and is using the knowledge that she's learned through her personal journey to raise awareness and to create a supportive Facebook community, which has, I believe, around about 7,000 members now. And she's also published papers on how to support women through POI, and has very kindly stayed up late over there in the US near Washington to join us today. So welcome, Karima.
Thank you.
Karima's going to talk to us about her experiences and global advocacy in general. When we're talking about premature ovarian insufficiency or POI, there's a lot of confusion about the terms, about whether this represents, menopause or perimenopause, or what other things might be going on. Karima, do you have some thoughts about the terminology there? You would have heard from some of your support group people, perhaps?
Sure. Primary ovarian insufficiency is the scientific name. Premature ovarian insufficiency is the chosen name that patient would like to call their condition. So our condition is not called menopause, early menopause, or perimenopause. So I want everyone to learn it, support it, and use it. No more excuses, because that's what causes the delay of our of diagnosis, or that's what causes the misdiagnosis of majority of women and girls who have POI.
That's a really important point you make, for that medical clarity on the diagnosis. So thank you very much for bringing that to our attention, Karima.
Kelly, thank you for having me. I was diagnosed with POI in 2007 after several years of struggle. And really, my struggle started when I was not able to get pregnant. I was not on birth control, and I was not getting pregnant, I saw different GYNs and was told to just, maybe stretch, just relax and wait and see. Then years later, I get pregnant, and then I lost my period completely. And I went and I saw different physicians. I saw an endocrinologist, no, more than one endocrinologist, GYN, primary doctor, just name it. And they kept telling me just it's all your issues are due to stress. And it was a time where I started thinking, it's really, is it in my head? Because I really started doubting myself. But in the meantime, all my symptoms were real. I was feeling my symptoms emotionally, physically, everything. And therefore, that's when I really started thinking I had to take the matters in my own hand. But in the meantime, I felt ashamed because I did not know much about my own reproductive health. The only thing I knew at the time, it was like really my menstrual cycle, and that's it, nothing more. Have never paid attention anything. If you have any health issue, you just go to the doctor and let the doctor figure it out for you. So therefore, after that time, I gathered my medical records and I started analyzing them. And that's when I found out that all these doctors were repeating the same tests. Then I went back to my OBGYN and I asked her at the time, could you please do something different? Test me, do something different. And she did. And weeks later, she called me. I was at work. I will never forget it. And over the phone, she told me that I have something called POF, premature ovarian failure. And now the name has changed. And I typed it as she was telling me. And that's when I saw everything I wanted to see, but nothing that a patient wanted to know or to find out. But in the meantime, I felt sadness, but in the meantime, I felt joy in a sense that is my issues have a diagnosis, have a name. And then when I asked my doctor if she could see me next day, and she said no, I had to wait another 2 weeks. So 2 weeks of agony, 2 weeks of pain. And then when I went back to her, she didn't prescribe any medication. She just left me alone and told me that there is no charge code, or there is a definitive code that she could charge the insurance. That's a case like mine needs to be taken to a research hospital. So therefore, I went back online and started doing my research. And that's when I found that 30 minutes from my home, there is a program at the National Institutes of Health, a protocol for POI that I applied to and I joined 2 months later. And that's where at NIH, that's where I found out and I learned everything about POI. That's where I met the first women with POI. That's where I also was prescribed my first HRT. So therefore, because of the pain I suffered, because of the isolation, because of everything I went through, I didn't want another woman to suffer, to go through the same thing. And I felt that starting an online group would be the best choice, as women could be in a safe, comfortable home or place, and to start talking to others by writing or by video calls. But and if they happen to be somewhere else far away from a meeting location, they can just join the Facebook group that I created around 2008, 2009.
That's a fantastic service that you've created there, fantastic support service. You've created a network for all these other women who are going through it. I also have some questions for you, if that's all right, Karima?
Yeah, definitely.
Yeah. So you've spent a lot of years creating this space and connection for women with POI around the world. What originally inspired you personally? Like, were you modelling that off other groups that you'd seen, or why did you particularly choose that?
Is advocacy was born for me out of necessity. So I had to survive. Advocacy helped me through all the troubles, all the pain I was going through. And I felt that peer support is the most powerful tool. And when a woman is diagnosed, she can go online and find good information. If awareness is raised and more information about our condition is available, and also she can join that group easily. And that's what I felt, that advocacy doesn't have to be loud, it just has to be present. And the online group at the time was the best thing that could, the best solution at the time for me in during 2008, 2009, because women at the time were very silent about their condition, were ashamed to talk about their condition. They were fearful of others to find out about their condition. And that's the reason I felt the online group was the best solution at the time.
Yeah, I'm totally hearing you on that. You know, as somebody who's founded a menopause clinic that is completely telehealth, I'm very, very aware of the ability that technology gives us to do that outreach to people wherever they are and connect them together with the services that they need and the support they need. So what an amazing service. Congratulations. So from the stories that you've been hearing through your support group over the years, are there common threads in how women experience POI, regardless of where they live, and how does that shape your advocacy?
Uh, the list is long and painful. Um, Across borders, women describe being dismissed by providers, receiving late diagnoses, and lacking clear medical guidance. Many are prescribed birth control instead of proper HRT. Some are pushed into fertility treatments early on, while others are rejected because of low odds of success. Um, Also, genetic testing is rarely offered. And there are stories also of women facing cancer, often aren't told that they can freeze eggs or tissue before chemo. So, beyond the medical, there is a deep emotional need to be seen, to belong, and to speak with others who understand. So, therefore, for me, women want a space, a sisterhood, so they can feel that they are not alone. And the Facebook group created that, and it has been almost 17 years, and it still plays an unbelievable role.
And for anyone who wants to seek out your Facebook group, what's it called? How do they find it?
Is the POI peer-to-peer support group, and now I could provide you the link on Facebook.
I think that's an excellent idea. We can put that also in the notes for the webinar. Thank you so much for sharing your experience, Karima. We really appreciate that. Our next guest is Georgia Rose, who was diagnosed with POI at the age of 15, which was a life-altering moment for her that led to a long period of depression and years of grappling with grief and anxiety about fertility and identity. Georgia's going to share her path from early diagnosis to figuring out HRT and becoming a parent through the reciprocal IVF using her wife's egg and donor sperm. Georgia now lives with her wife and baby son and works as a solicitor. Welcome, Georgia. And Georgia is going to talk to us about her teen diagnosis and fertility journey.
Thanks, Kelly. Thanks for that introduction. And thank you for your introduction to POI in general. It was really refreshing to hear someone talk in an informed way, because let me tell you, sometimes experiences, even with medical professionals, there seems to be basic facts about POI that go wrong. But anyway, thank you for that. I was diagnosed when I was 15 because basically I never got my periods and I hadn't started puberty. And I remember I had a friend group at school of about 10 other girls, and we each kind of told each other when we got our periods, and all the girls except me had their periods, and they kept asking me for a while, and then they just stopped because mine just hadn't started. And it was a super disorienting, difficult time in my life because I didn't know what was wrong with me, and I was really uncertain about the future. And it's obviously a time where your body starts to change, but mine hadn't. And I looked really, really young, and continued to kind of look that age between year 11 and 12. And so it was a tough time. The diagnosis itself, I went to see one specialist, and after that appointment, my mum called me. I remember being at a school swimming carnival and said that first specialist had said everything was fine, but that I needed to go and see a second specialist just to have some further discussions. And then I went off to the second specialist appointment and was told that I had premature ovarian failure. That was the way that it was described back then. And in some ways, to be honest with you, when you don't go through puberty at all, it does feel more like a failure than an insufficiency. But the way that it was kind of put to me was that I had no eggs, essentially. And I definitely felt that the focus was almost completely on fertility. And the man said to me, the endocrinologist said to me, look, one day when you meet a nice man, you can come back to me and you can try having a baby through donor eggs. And so that was what I went away with. I didn't have much in the way of follow-up. There was certainly no kind of psychological support or counselling or anything offered. And my GP was not helpful, hadn't heard of it and didn't understand. And I didn't have a lot of kind of family support, and my friends were just in a totally different phase of life. They were having their first kisses, first crushes. Their bodies were changing. It was fun. It was exciting. You know, they were getting independent and freedom from their families. And I was just in this completely different space. And I entered quite a long period of depression. And I could talk for ages about that, but I'll move on to kind of the present. I'm 31 now, and I've just had my first baby. I'm married to a woman, and we used her eggs, and we have a lovely friend who donated sperm, and I was able to carry a baby, and it truly is a dream come true. And I was the first kind of person diagnosed at my age that my obstetrician had ever had, and we weren't really sure how the pregnancy was going to go, but thankfully it went well. It was high risk, but none of those risks, well, most of those risks didn't eventuate, and the ones that did, we could manage. So it was a really tough time for me going through IVF and the fertility process. It brought back all of that grief, hit me like a truck from when I was a teenager. And I found myself having really awful, uncomfortable thoughts. Uncomfortable is an understatement. You feel it like a monster. You're not necessarily happy for the friends around you that have easier fertility journeys. And you start to really ask, why me, a lot. And while I never expected or wanted or put the pressure on having a baby to remove or erase that grief, and I still feel the grief, but what has eased is the thought that I had for a really long time, which was, am I ever going to get to be a mum? That thought now, it has gone. And so there's a huge joy there, even though obviously POI is a lifelong condition, and fertility grief doesn't go away just because you have a baby, and I wouldn't want that baby to have that pressure anyway of feeling responsible for that. So that's my story.
That's a beautiful story, Georgia. I mean, so like my heart breaks for you in terms of what you went through. You know, I can kind of, you just want to give teenage Georgia a big hug and go, it's going to be okay, you know, and it's just awful to think that the journey could have been so much easier for you with the right kind of support and information. But so glad for you and your wife that you're now parents. That's really wonderful. We do have some questions, if you don't mind me passing some of these on to you.
Sure.
One question here is that POI can be incredibly isolating. How does a diagnosis impact mental health and quality of life, especially for teenagers and younger women? And what role can partners, friends, and family play in supporting someone through it?
Thanks, Kelly. That's a really important question that I could probably speak about for hours. So I'll just try and pick some specific points. I think the first thing to say is, just speaking as someone diagnosed as a teen, it's a time when your identity and is really forming, and it's obviously adolescence. It's a huge time, and I think the diagnosis at that point has some really particular effects in terms of it completely crushed my sense of self, my sense as a developing woman, my identity. I never thought anyone would ever find me attractive. I constantly faced reminders because I would, for example, I went to go and pick up my Year 12 jersey, and the lady at the uniform shop wouldn't give it to me because she just was convinced that I was some person in Year 7 or 8 pretending that one of those jerseys was mine. And that's one example. I could give you hundreds. And so the identity loss, the confusion, the isolation, none of my friends understood, and they, some of them made super unhelpful comments like, well, at least you can have sex now and not have to worry about protection. One of the comments that I got from a friend, and then I just thought, oh, well, that's it in terms of talking to my friends about it. And I could again go on and on, but I think in terms of what's really helpful, I think my first thing is I'm really passionate about helping other people who've been diagnosed with POI. My first thing is I think we need some kind of government-sponsored mental health support. But that aside, I think partners and family can really help by validating the grief. My grief is and was a normal, healthy response to a massive disenfranchised loss. And now that I know that, I don't feel the shame that I felt for years and years and years. But I didn't know that until maybe a couple of years ago. And so I think validating that grief and ideally educating yourself if you've got friends or family diagnosed, so that you don't ask silly questions or make silly comments that can be hurtful. And and I guess the one comes with that, asking questions rather than assuming things. And the third thing I think that's incredibly important is connecting with others. I can't tell you how helpful it's been for me through the Daisy Network and other networks to find other people who either know someone or have themselves suffered POI, whether as a teenager or older. It's changed my life.
That's incredible. Actually, that leads into another question here, which is, from your perspective, what are the biggest gaps in care and support for women with POI in Australia, and how would you like to see the system change for the better to meet the needs of young women and their families?
Thanks, Kelly. I think, again, two main points would be the first gap in support is mental health support. In my opinion, it's an incredibly difficult diagnosis to deal with at any age. And I think it should go hand in hand that if you get this diagnosis, that there's mental health support. I don't know through what system funding that has to happen, but I just think that's an absolute necessity. It could have saved me I don't think it would have saved me from grief, but it would have saved me potentially from years of depression and anxiety. And the second thing I would say is it's so confusing and disorientating when you are in appointments with medical professionals and they do not know about POI. I am not talking about your random GP that you've called after hours, that doesn't know much about anything. I'm talking about your regular GP, your endocrinologist. Sometimes they do not know what they are talking about, and they say things that are either wrong or misinformed or half right. And it is really hard because if they don't know, who does know? And you're just left in this really difficult place. In saying that, there are I now have an incredible medical support team, endocrinologist, GP, psychologist, who are amazing. So I'm definitely not kind of denigrating the profession or anything, but I just think this is a gap in kind of education potentially. And there's an opportunity there because even some basic education about this condition would be really helpful. So I guess my two gaps would be mental health and kind of particularly GP specialist education.
That's really insightful. Thank you for that. And I guess as a GP myself, I would mention a couple of things. So if anyone's watching and is in this situation, you can get a GP mental health care plan written up by your GP, which will help you to get subsidised sessions with a psychologist. So really important to mention that to your GP if you're someone going through this diagnosis process at the moment. And also that I've found a site with guidance from the RACGP about diagnosis and treatment and everything like that, which is guidance for doctors. And I'll put that in the show notes and resources for this webinar so that if anyone wants to look at that or refer their GP to that, that you'll be able to go and see that. Okay, so thank you for that very much, Georgia. So moving on, we'll go and talk to Renee now. Renee was diagnosed with POI as a teenager shortly after the removal of a cancerous thyroid tumour. The lack of medical information, research and support after her diagnosis has led Renee on a journey to help better support those who receive this devastating diagnosis. And she's here to share her own experience and goals for the future. So in particular, Renee is going to talk to us about diagnosis and systemic failures for her. Hi, Renee.
Hi, Kelly. Thank you so much for having me. It's a real honour to be here and be a part of this webinar. Like you said, I was diagnosed with POI at the time, same as Georgia and Karima. It was called premature ovarian failure and still reflects that on my medical records today. But I had a tumour removed from my thyroid at the age of 14. Unbeknownst to me, and I think unbeknownst to medical research at the time, there is a big link in women between the thyroid and the ovaries. And so, in removing one of my thyroid glands to remove the tumor, my ovaries evidently failed. So, at the age of 14, the tumor was removed, and at the age of 16, I had the diagnosis for POF, or premature ovarian failure. But during that diagnosis, it was a very lonely time. To again echo Karima and George's experiences, I wasn't provided a lot of information. And truth be told, because my medical team at the time was so focused on ensuring that the thyroid cancer didn't spread outside the tumor, so I was one of those incredibly lucky cases where the removal of it removes the cancer, but that was a big focus of ensuring that that didn't spread throughout my body, and that meant that my POI diagnosis sort of fell by the wayside, and that I was put on the contraceptive pill at the time, which essentially masked or helped remove my POI symptoms. But at the time, obviously being a teenager, it was a pretty normal thing for 16-year-olds to do, to go on the pill. So I just didn't understand at all at the time that was my hormone replacement. So fast forward, I didn't have any more complications with the thyroid cancer, which was fantastic. When I met my now husband, I decided to go off the pill. I think just my friendship group at the time were all going, okay, it's just a good, healthy thing to do for your body, give your body a break, go off the pill. Evidently, I did that for about a month. I thought, I'm going to experiment with this. Went off the contraceptive pill for a month and started getting dreadful hot flushes. Essentially, all the menopausal symptoms came back. And so I kind of felt like I was re-diagnosed at the age of 21, just from doing that little experiment. So my journey has been a really interesting one, whereby I was diagnosed at the age of 16 and have my medical records reflect that. But I really had no concept or understanding of what I'd been diagnosed with until my early 20s. And then at the time jumped into to fertility options and treatment. But that's essentially my journey and story. These days, again, like everyone here, I'm really just trying to advocate for other women with POI. I think our voices deserve to be heard. We deserve to be seen as people. We have a real diagnosis that is very, very devastating for women. For me, it was quite a loss of identity. You know, there's a lot tied up with women and your reproductive organs. You know, what you're being a mother seems to be a path to destiny for a lot of women. You know, just innately, just from the fact that you're given, you know, baby dolls to play with from a young age, and you're really told that, you know, that's your path in life. You're a nurturer, you're meant to be a mother, and when that gets taken away from you, it is exceptionally devastating. So it's been an emotional journey for me, personally, but I just, I'm so motivated at this point in my journey just to advocate for myself and for other women, and hopefully get to a place where the women being diagnosed today don't have to deal with the same lack of information that I had to.
In such admiration for you, Renee, and for all the guests here today who are talking about your experiences, because what you've gone through is so personal and formative, and obviously was not a great experience either. But you've really turned that around by being able to use that information to help other people and raise awareness. So we really thank you for that. Would it have made a difference in your case? Like, from what I'm hearing, it sounds like nobody spoke to you, when you initially were diagnosed, about infertility, and, that there might have been something that you could have done at that point that could have helped, your chances of becoming a mother later or so. Did anyone have that conversation with you?
Yeah, that's right, Kelly. So no one had that conversation with me. Again, the focus was just on ensuring that the tumour and the cancer was being managed, which meant that there was just no conversation in terms of the POI. And if I speak from a place of honesty as well, being in such a lucky category to have had a tumour removed and have the cancer be encapsulated in the tumour, I rarely ever talk about having a thyroid tumour or thyroid cancer, because it was kind of just a miracle surgery, and then after that I was fine, and extremely lucky and grateful for the outcome of that. The diagnosis of POI was far more devastating and impacting on my day-to-day life and my future, really. Being diagnosed from such a young age, I think it would have been incredibly helpful, like Georgia said as well, to get mental health advice and assistance at that time, and really have someone sit down to me and understand the diagnosis. Because I was going to a lot of my medical appointments on my own, even at a young age. So it was just way too hard to conceptualize what was going on, and coupled with the fact that there was just not a lot of research, and there still isn't, as we all know here, probably on this webinar, there still is not a lot of research on POI. So the lack of information is really like a big challenge for any woman that gets diagnosed.
Absolutely. I've got some other questions here, if that's okay.
Yeah.
So what changes would you particularly like to see in how clinicians talk about POI to women at the time of diagnosis? And particularly, the messaging, the resources or supports that you think would make a meaningful difference at that time?
That's such a great question, Kelly. I think, and again, I have to echo previous presenters here, but coming from a place of validating, I think my own experience with medical professionals it's been very matter of fact, and there hasn't been a lot of, that message hasn't been delivered with a lot of empathy. I do recognise that medical professionals aren't, trained mental health professionals, but I think delivering a diagnosis with some sort of empathy, and then resources to be able to help and cope with the information that you've heard would be extremely helpful. To share one experience I had in the past, it was only a couple of years ago that I went to a doctor to get a copy of my medical records, and this particular GP opened up my medical records and started laughing, because they looked at me as a young woman and then saw the word menopause on my medical records and thought it was a mistake. So that was extremely hard to sort of bear with at the time. But that's just one example of a circumstance I've sort of had to bite my tongue and bear, and know that was really painful. So just getting the validation in itself that this is a real condition, and that it's okay to grieve, and it's okay to feel that disenfranchised loss would be huge. But yeah, then even support networks as well. So obviously that's what we're that's what our end goal is, to create a support network for people diagnosed with POI, so that they don't feel alone, that they do immediately feel validated, that they have some information and research to go off, and then they have their tribe, like Karima said, they've got that community of people there to go, okay, I don't have to feel so alone in this.
Thank you very much for that. And I know amongst our guests here, you guys have a whole bunch of really fantastic resources that you've learned about over the years that we can share with our audience here. So we'll include a bunch of those in the show notes and webinar text afterwards. And I might come back to you at the end, Renee, and you can tell us a little bit about what's afoot here in Australia in terms of support for people, and trying to build that community a bit more. But for now, I'd like to introduce Imogen. So Imogen Hogan was diagnosed at 31 with POI after a series of unexplained illnesses, and very shortly afterwards was also diagnosed with melanoma. Talk about a double whammy. She's going to talk about the difference between how these diagnoses were managed at the time. Thank you so much for joining us today, Imogen, and sharing your experiences.
Thanks so much, Kelly. So a bit different to, Renee, maybe more like Karima, but I was diagnosed 3 years ago now when I was 31 years of age. So I had been diagnosed when I was 18 with Hashimoto's, which, just going off Renee, and the thyroid connection, it's obviously something that is quite prominent, I think, with a lot of people diagnosed with this condition, and as we've said, under-researched as well. So it's still not known why I have this condition, but it's, they say, likely to do with the Hashimoto's diagnosis that I did have from 18 years of age. All through my 20s, I then sort of struggled with different medical conditions. At around 24, I was having quite what I know now to be quite debilitating night sweats, where I would change my sheets almost every night. I'd sleep on a towel. I was also having quite bad headaches at that time. I went to a neurologist, ended up being in hospital for a few weeks. No one tested my hormones at that stage at all. And it just continued for another sort of 6 or so months of like drenching night sweats, and then sort of was on and off. But then when I got to about 29 years of age, I think I'd just been having a Euro summer and came back and had really bad melasma all over my face. And, I was like, I don't know what this sort of condition is. I'd never seen it before. And then someone said, oh, well, maybe your progesterone's out of whack, so get an IUD. And so, yeah, at around 29, got an IUD and then never had a period again. I didn't know that was, I thought that was normal when people have marinas, that they don't get periods. I'd worked as a solicitor for sort of 8 or so years and always wanted to be a barrister, but wanted to sort of do that before I had children. I studied really hard and, did the bar exams, passed, and then did the bar practice course, which is sort of the month-long course where you sit in a room and learn all the things of how to be a barrister. But I moved down to Sydney to do that and to, take that on. And as soon as I got into that basement and started being a barrister, I got really, really sick. I was exhausted. I couldn't really get up and down the stairs to where we had to do the classes. I had hot flushes. We have to wear the wig in court, and we'd be doing our mock trials, and people would be like, oh, I didn't realise the wig was so sweaty. and like no one else is sweating. Everyone's the same age as me, or even older, and no one else is sweating in their wig, but I was just there with the upper lip. So a few months of different, getting blood tests, every week or so. And then my sister, who's 2 years younger than me but had been trying to have a kid, said, "Oh, just get your AMH tested, because, I know you don't want to have kids for a few years, but just test it because, I'm struggling." And I just thought I'll chuck it onto the blood test list anyway. And then that came back, and then it was 0.02 AMH, and basically no estrogen. At that point in time, my GP decided, well, you should probably try and get some eggs if you have any. Let's get your marina out. So that was taken out. And it was only because I was sent to an endocrinologist to see about my thyroid if I was going to be doing IVF that the endocrinologist started asking me questions. I think I walked into her office at 8 a.m. at St. Vincent's and had walked up, got in there, and I was like, "Oh, these glass windows, beautiful, but it's so hot in here. How do you cope?" And she's like, "Oh, okay, so what do you here?" "Okay." I was like, "God, you should just get really hot all day." And she was just like, So she ended up doing like an hour and a half session, and she just diagnosed me with premature ovarian insufficiency, sort of accidentally. I didn't actually know. Well, my GP didn't send me there for that purpose, and I didn't know that that's sort of what I was doing. But between the night sweats, the muscle aches, the exhaustion, we sort of put all of that together. And then went to the IVF clinic, and they said that they wouldn't do IVF with me, because there wasn't a chance of getting my own eggs. And then I had, I think, a counselling session at the IVF clinic, and my sister went and met me there, and I was walking from Martin Place station just a few blocks, and I couldn't even do that because the marina had been taken out. The progesterone was the only hormone that I was getting at all. Once that was gone, I really had no strength, and the brain fog was so bad I couldn't do my job. I couldn't do anything, but I could hardly even get to this appointment. And getting up to that counsellor, she then went and had a word to the doctor, and I could sort of look at her pointing at me and things. And then the doctor came in, and he's a lovely fellow, but he's a bit out there, and he's really like, "Okay, so they think you need to probably go to the mental hospital because you're very, very depressed and everyone's worried about you. But I think just give me 3 days with estrogen and let's just check in again. Okay, can we do that?" And I was like, anything could happen at that point. I was like, I don't care. And my sister was like, "Yes, that sounds like a good idea." And I was just, it's not only the mental depression, but it's just the physical exhaustion on top of that. And I got some compound, sort of what they normally give to IVF people, estrogen. And I woke up the next day with just a sort of slither of myself back, a tiny slither. And I was like, "Oh, it's possible. Like I can have my brain back, and I could maybe be a little bit of myself." And it slowly got better. But yeah, it's the physical sort of grief when you're already dealing with, I didn't really fully appreciate what had been taken away from me at that point. But you're dealing with all of these physical conditions that also mimic the mental conditions. You're so alone. I've never, I've had a lot of difficult things in my life, but I don't think I'll ever have to go through anything as hard as those few months. And the lack of support and understanding was just astounding. I obviously didn't know what was happening. But thankfully, I did a few Zoom sort of group sessions with the Daisy Network in the UK, because if I didn't have that, I don't know if I would be here. But just I spent my whole life being very proud of our medical system, and to have to go both on Facebook groups that are, and thank you so much, Karima, but Facebook groups that are either set up in America or overseas, or getting a support network from someone, from an organisation not funded in the UK. It's just shocking to me that we, as Australians, we're in this position and we're going on these Facebook groups and trying to compare what other different people's blood test results are, and that, you know, they don't do AMH in the UK, so they do different tests and all these things, and we have to do this research in Facebook groups to know about our condition, to then know what questions to ask our doctors, to then get them informed, to know where to go from there. And yeah, it's not just it's the physical, obviously the mental, and Georgie and Renee have spoken a lot about that, but physically I have arthritis in my knees, my shoulders. The rheumatologist has connected that to the lack of estrogen. It's this something, my eyes, when I got diagnosed, the neurologist thinks that the something with the exhaustion that makes so I have double vision now. I didn't used to have that. It's just something that is like an octopus that gets in every single aspect of your life, and when you're left without any direction and you feel like, you know, I think a lot of us have said the original definition kind of feels a bit true. You feel like a failure. It feels like this, or your ovaries have failed you. You know, insufficiency sometimes feels like it's a bit of a, you know, too short. It doesn't take the gravity of.
I think the big failure here, Imogen, is the failure of the medical system to support you, because it's not a personal failure. It's not something that you could have controlled. And on behalf of the medical profession, you know, I do apologise for the insufficiency of our medical system in supporting you guys. I think it's just awful. So, you know, you've spoken about, like, I know that you've also had, you know, the melanoma diagnosis not too long after that. What do you think the POI care pathway could learn from the melanoma diagnosis and treatment pathway? You know, like, what was the stark differences there?
Certainly. So about 2 months after I was diagnosed with the condition, I then was diagnosed with a melanoma that I'd had on my face since I was born. And, you know, I required 3 surgeries and getting my lymph nodes out and everything like that. But as soon as they did the tests, they found that, yep, that's a melanoma, you're going to need more surgeries. I had my GP call me straight away. I'm so sorry, it's a melanoma. Here's this information, this specialist is going to call you. Then the Melanoma Institute get in touch. They give me a little book about, you know, this is your grade 2 melanoma. This is all of the things you need to know. These are your next steps. This is what it looks like in your skin. This is what could happen. You know, just that little book. If I didn't have that, and if I didn't have that direction and those people who knew the way forward, because it's not, you know, if someone thought, oh, well, if you've got a melanoma, you've got to figure it out yourself, everybody would be like, that's outrageous. But that's exactly the position we're in with this diagnosis, and it's exhausting for people that are already so exhausted.
It sounds a little bit like with breast cancer too. You know, they've got a great, you know, machinery around breast cancer diagnosis and management, and, you know, the McGrath network and the breast cancer nurses.
All of the things.
Everything swings in. People send you, I can tell you from personal experience, people send you, you know, bras, and, you know, they send you accessories to help you, you know, through your surgery, and they send you lots of information and support groups and whatever.
I managed to fundraise in a few days like $15,000 for Melanoma March, because my surgery was actually in March, and you know, that's how a lot of people came to realize that I'd been diagnosed with that. And everyone's like, oh my God, I'm so sorry, and I'm like, oh, I can do it. This I can deal with. This is easy. I can deal with this. People know what they're doing. The other thing I can't deal with.
Mm, that's such a really important, experience that you've had there to share, and really good insight into what we're not doing right as a supportive medical profession. Thank you very much for that, Imogen. I'm going to move on now to our last speaker, Belinda Pisana, who became aware of the issues of POI through her teen daughter. Belinda's daughter has had a terrible time in trying to get a diagnosis, and so it's another one of these medical failure stories, unfortunately. And they were brave enough to speak at the Senate inquiry and pass on that story to try and inspire change through government. So thank you very much for doing that. Belinda is a clinical and health psychologist, and she's actually now doing PhD work in this area at Bond University. So please do tell us all about your mum's journey and your research, Belinda.
So I'll introduce my research, which examines the experiences of women with POI. But I'm going to start with the beginning of my experience as a mum, which is what led me here. So in my daughter's case, as in so many we've heard today, the journey to diagnosis was long. It was frustrating. For years, my daughter complained about very infrequent menstrual cycles, delayed puberty. These issues got overshadowed by other symptoms. She reported she was dizziness, fainting, extreme fatigue, tachycardia. She was having severe migraines, joint pain, her joints would swell. She described having hot flushes, and in her doctor's notes, the doctor put a question mark next to her words and wrote fever instead. This was despite a test already being on her file, showing she had very low estrogen and an FSH level of 51, clearly indicating POI. Her doctor brushed off her concerns about puberty, telling us she was within the normal curve, that it was basically part of the normal variation you see in people. He diagnosed her with chronic fatigue syndrome, referred her to psychologists for support with anxiety. Unfortunately, her symptoms were so severe, I guess a lot of what Imogen was describing was very familiar. She had trouble walking up the stairs. She had trouble getting out of bed. She had to be removed from her high school and enrolled in distance education. When she finally got a diagnosis, she was 18, almost turning 19. So the impact of the delays, because she'd started complaining about this when she was 13, meant she missed the critical window for hormone replacement therapy to induce puberty. She needed to start that before she was 17. She lost any opportunity to explore fertility preservation options, and she had osteopenia. And she'd also, not surprisingly, developed anxiety and had started to experience panic attacks. In terms of being her mum, like my experience, when we got the diagnosis, I was in complete shock. I didn't know anything like this could happen to someone so young. But my daughter said it was a relief because she knew there was something very wrong with her body and she had been afraid she was going to die. By the time we finally discovered she had POI, her health had deteriorated very significantly, and our entire family was quite traumatised by the process. And it had pretty significant effects on her mental health. So as we've talked about, we know POI is linked with increased risks to brain, bone and heart health. And there's also that increased risk of depression, anxiety, lowered quality of life, and it's really critical that these aspects are part of the conversation when we talk about POI. Mm. From my perspective, I still have a sense of disbelief when I think about how her case was managed. And it isn't just the delayed diagnosis that was so difficult. It was the systemic issues we faced trying to address the mistakes that were made along the way. I just couldn't believe that this was normal, that the way she had been treated wasn't normal. So when we reached out to the healthcare watchdog for help in investigating what happened in my daughter's case, we realised that her voice didn't really matter there either. The notes, her doctor's notes, only showed one reference to her ever raising concerns from the age of 13 to 19 about delayed puberty, and that was when she was 14. And her doctor told the HCCC that, yeah, she had mentioned it that once and only in passing. The notes were so different to our recollections of our many consultations that we asked the watchdog to review the edit history. They indicated that this is already provided with the file, and eventually they realised that it's not. And when they realised that, they said that it's not something they look at anyway, and it's not in their purview to get that history. What they did tell us was that as POI is rare, the treatment my daughter received was consistent with what would be expected from a competent medical practitioner. So he didn't behave in a way that was deficient compared to other doctors, and that's true. From listening to other women, our experience was certainly not unique. The thing is, when I started looking into it, I guess myself, I quickly found POI isn't rare at all. And the research indicates, as many as 1 in 25 women may be affected by it. And there are guidelines which clearly indicate how a young girl or woman presenting with menstrual disturbance should be managed. So, I guess the experience made me, want to advocate for better research and better support systems for women with POI. And eventually it led me to making the decision to start this PhD at Bond Uni. So I've been working on development of a POI-specific quality of life scale, which will help to measure and understand the impact on women's lives. The research was inspired by similar efforts in other chronic conditions, such as endometriosis, where patient-reported outcome measures have driven more patient-centred care. So the process involves asking women with POI about their experiences. We used open-ended surveys and recruited from online support groups because we wanted to ensure we had a sample that represented women with POI across all age groups, including younger women who've been very underrepresented in the research. The project, it aims to develop a new psychological measure that's designed specifically to assess quality of life for women with POI. We're planning to validate the tool in 5 countries, so Australia, the United Kingdom, New Zealand, Canada, and the United States. It builds on previous work by researchers in a hospital in Iran, but they indicated that there could be some cultural and linguistic limitations to their tool, and there is. So the new tool has the potential, we hope, to improve patient care and outcomes because it will assist healthcare providers to target interventions based on a woman's specific needs, and also help researchers as we can monitor effectiveness of intervention strategies and hopefully, encourage some intervention research, which really hasn't been done. Basically, if we don't ask women, what they're struggling with, we won't know where to target the intervention. It's clear that POI needs to be prioritised in both healthcare and research, and I guess, I know all of us here really appreciate the opportunity that you've given us to talk about this today. So thank you, Kelly. Yeah.
Very welcome. That's such a heartbreaking story, and I remember just being so deeply affected by it when you and your daughter very bravely appeared at the Senate inquiry. Thank you so much for doing that and advocating on behalf of other people as well.
Yeah. Thanks.
Yeah. So in your research, is your research showing any patterns in how age at diagnosis or current age affects the quality of life or emotional well-being for women with POI?
Yes, mine is, and there hasn't been a lot of research looking at age at diagnosis, and we did ask that question. And we were able to get, because we used, I guess, Facebook's and social media support groups, we were able to access a larger age range of women. So we have women from from early 20s until their 50s who responded. And we did ask about their age at diagnosis as well. And so what the previous research has shown is that younger, unmarried and childless women with POI tend to have higher psychological distress than those who are diagnosed later in life. And having a partner, being married, having children are protective factors. And naturally, younger women, teens and women in their early 20s, wouldn't accomplish a lot of those life milestones yet. And then they're facing unexpected health challenges. So in my research, I guess I'm seeing younger women with POI indicating they've struggled with dating, starting relationships, fearing how a new partner will react when they disclose their condition. And this ties back, I guess, into that isolation and stigma. So some have indicated they found it easier just to avoid dating altogether. They've had raised issues with body satisfaction and identity, and age at diagnosis seems to be very important here, with women who experience disruption to what we see as, these normal milestones such as puberty, where they didn't experience breast development or start menstruation. Many described feeling at school, feeling amongst their peers ashamed and different, feeling like outsiders, withdrawing from their peers, or feeling like they needed to pretend that they're getting their period to kind of fit in. Many of the women who were diagnosed in their teens appear to be reporting ongoing distress, isolation, body image issues and identity issues, which have followed them into midlife. So I think current age and age of diagnosis play a significant role. Younger women, a lot of them haven't finished their education, and the symptoms can impact upon their ability to study. They haven't established careers, they haven't had a chance to establish their identity. And in terms of women with POI, they are a significantly smaller group, with the majority of women being diagnosed over the age of 30. So that means even in the support groups, younger women can feel they're different, and so that sense of isolation can be quite strong. So yes, I guess I'm just starting to dig into what women have told me, and we will release all of that, what comes out of it. But at the initial, that seems to be sort of what's being said.
And I know I've talked to you about this before, but, in terms of seeking out support online, it's really not appropriate for these very younger women to be in the normal menopause and perimenopause support groups, because they're so much younger, their life experiences are so different, and they don't really want to be hearing women talking about their heavy periods and problems with their kids and things like that. So I think it's really important that they have their unique spaces where they can find support that they can relate to.
Yeah. Yes, absolutely. And we can make a difference to that experience, that the experience patients have with healthcare providers right now. I kind of think the first treatment for POI is a good doctor. And by that I mean someone informed.
A therapeutic connection with a health professional.
Yeah. Because if it's that, it's like she doesn't have to fight the medical system. She can focus on dealing with the condition itself. And the research backs that up, that improving kind of clinician-patient interactions is one of the most actionable findings we have in enhancing quality of life for women with POI. So that's my message, I guess.
Now, to finish off with, I'm going to ask Renee to speak to us again about what plans are afoot here in Australia to help develop support networks and resources for people who are suffering from POI. Renee, can you tell us a bit about that?
Yeah, sure. So, as we've identified here today, Kelly, in this webinar that you have kindly organised, a lot of us have experienced a complete lack of information, particularly in Australia, in regards to our diagnosis. So, we have identified as a community that it is going to be incredibly important moving forward that anybody that gets diagnosed with PIY has the adequate support. What we're doing as a community to do that is we have a long-term goal to establish a charity within Australia that is for anyone who is diagnosed with POI. In the meantime, whilst we establish that charity, we've already established a newsletter that has been running for a few months now that I'd love to invite your viewers and listeners to join. So I'll be sending you a link after this, which I'd love if you could put in the show notes. And then, yeah, anyone who would like to join that, please do. All you have to do is put in your email address. Once a month, you will be sent a newsletter which has information in it. It also has my details and details of a couple of others as well who are a part of this webinar who can help support you in the meantime. We're not medical professionals ourselves, so we're all coming from the perspective of receiving this diagnosis. And it's our aim and our vision to be able to validate those who receive it and put out the information that I guess we know to be true and correct through our own experiences, with the ultimate goal as well of teaming up with some medical professionals like yourself to, just spread the right medical advice for these people that get diagnosed as well.
Which is how we got together in the first place, isn't it? So,
That's right.
WellFemme was looking for, how do we get some traction here to help the women suffering from menopausal symptoms who really need it? And this was the obvious underserved community in terms of, like just lack of information, resources. So WellFemme is definitely going to be working with your networks, all of our wonderful guests here, to make sure that we help to inform the development of resources that are needed here in Australia and also to help get the word out. So if you've signed up for this webinar, then you're on the mailing list that will be able to contact you once that charity is up and running and let you know any developments around forming this POI network in Australia, the charity, and please do sign up for Renee's really fantastic informative newsletter as well. So thank you very much on behalf of all the people in Australia suffering from POI. Thank you very much for all your time, all of our wonderful guests, and in the generosity in sharing sometimes quite painful experiences, which have really helped to enlighten and inform our viewers. So thank you again, everyone.